To inject insulin for diabetes, there are a few different devices that you can use. These two devices are called pen devices. So the first one here is called a Nova pen, and the second pen is called a Lantus pen. So for the Nova pen, the equipment you're going to need is some alcohol, the insulin itself, some needles, and then the injector. So to prepare the insulin is normally stored in the refrigerator, but before use, you can take this one out, and then to warm it up, you can roll it gently between your hands to get it up to temperature so it's more comfortable to inject. Also take a look at it when you take it out of the refrigerator, just to make sure it should be cloudy and it should be uniform. If you see any clear color or any discoloration, then it's no good and you need to get some new insulin. To use it, you need to take the cap off of the pen and then unscrew this part, and this goes down, the plunger goes down. Then you put the insulin itself, the orange part, goes down, and then you have the numbers that indicate how much liquid is left in there. And this screws onto the pen. And now it's ready to use. So we need to get the plunger up to the bottom. So you twist this to get the plunger up so that it meets the bottom of the insulin. Okay, that's good to go. So now we need to put on a needle. So before you want to put on the needle, you have to take a little bit of alcohol and just clean off the tip so it's ready to use. Put on the needle. Make sure you put it straight on first, and then twist to tighten it. Okay. Now you can take off the cap to expose the needle. Then the first time you use it, you want to inject a couple of times just to make sure that there's liquid coming out so that you're actually injecting insulin when you use it. So to do that, there's a small window that shows how many units of insulin you're injecting, and then this, you twist this to set the dose. So when you're trying to just make sure that it's working, first set it to 2 units, and then push, and keep repeating until you see liquid start to come out the tip. Right there. So now it's ready to use. And then in order to use this medication, you set the dose to whatever your prescription says. And to do that, pull out this and twist. So if you need to inject 5 units, turn to 5 in the dosing window. And then when you're ready to use it, you're going to inject either in the back of the arm, in the abdomen, or in the thigh. And then before you use it, again, you're going to want to use alcohol to clean off the site. And then you're going to take an inch of skin and pinch, and then inject straight in, push down on the plunger, hold for about 5 seconds, and then remove, and then release the pinch. And then to use this again, you can use the needle about 2 or 3 times before you need to change it again. However, if you use it more than that, there is a lubricant around the needle that actually makes it easier to inject and makes it more comfortable. If you use it more than about 2 or 3 times, it can start to catch and start to be a little irritating. So at that point, we would recommend changing the needle. And then overall, this medication can be stored just at room temperature for about 30 days. And then after that point, you need to change and get a new vial. For the Lantus pen, this is very similar. However, it is a single-use pen. So when you take off the cap, this is already installed, and it isn't replaceable. So to use this, it's very similar. You're going to use alcohol to wipe off the top, and then you're going to install a needle in the same way. And then the dosing is also very similar. There is a dosing window on the side, and to change the dose, you twist the dial here to get the number you need. And then to inject, it's the same. You push this to inject the dose. And again, this medication can also be used for 30 days at room temperature before you need to get it replaced.